Poverty lines in India. In 1962, the Planning Commission constituted a working group to find out an appropriate minimum standard of living for a population. The recommendation of the group was that minimum consumption expenditure for a household of 5 persons should not be less than rupees 20 per person per month in rural and rupees 25 per person per month in urban areas in 1960-61 prices. In 1979, the Alag Task Force defined the poverty line as monthly per person consumption of rupees 49 for rural and rupees 56 for urban areas at 1973-74 prices. These amounts correspond to the value of a basket of goods and services that covers the basic minimum food, which is calculated as per capita daily calorie requirement of 2,400 kilocalories in rural areas and 2,100 kilocalories in urban areas. Non-food items such as education, clothing, footwear, health and transport are also included in the consumption basket. In 1993, the Lakdawala Committee suggested the continuation of the poverty line approach, fixed to calorie norms and a fixed consumption basket. Using the Lakdawala Committee's methodology, poverty headcount ratio in India was reduced from 54.9% in 1973-74 to 27.5% in 2004-2005. From more than half of the population to a little more than a quarter of the population were found to be poor during this period. The proportion of poor was declining. At the same time, it was consistently higher in rural than in urban areas. From the late 1980s, this gap had reduced, which means that the extent of poverty in urban and rural areas were coming closer. In terms of number, though, rural poor continue to outnumber the urban poor by 3 times. More alarmingly, the total number of people living in absolute poverty had hardly changed from the 1970s till the early 2000s. In 1973-74, there were 321 million poor people. In 2004-2005, this number was 301 million. This, I suppose, is in effect the general increase in population. Poverty line methodologies get revised from time to time to take into account various factors. In 2005, the Tendulkar Committee was constituted to review the poverty assessment methodology. This is important because the poverty line used in India at present, 15 years later, is still based on the Tendulkar Committee's recommendation. According to this, households with per person per day consumption of goods and services equal to or less than rupees 33 in cities and rupees 27 in villages will be deemed poor. For a family of 5, this requires a monthly income of approximately rupees 4,000 for rural and rupees 5,000 for urban areas. The Tendulkar poverty ratio led to the upward revision of poverty data. Both the proportion of poor as well as their numbers increased. In 2004-05, there were 407 million poor people as against the 301 million claimed according to the Lakdawala estimates. However, the same calculation showed a steady decline of poverty. In 2011-2012, only 22% of our population and 270 million people were suffering from absolute poverty in India. However, the number of rural poor was 5 times higher than the poor in urban areas. In 2012, the Government of India set up the Rangarajan Committee to review the Tendulkar method. Based on the Rangarajan Committee's recommendations, the poverty line would work out to be per person consumption expenditure of rupees 32 in rural and rupees 47 in urban areas. This would be calculated for a family of 5 to sustain this consumption level. To sustain this consumption level, a family of 5 would require a monthly income of rupees 4,860 in rural and rupees 7,035 in urban areas. As the poverty line gets revised upwards, the proportion of poor is likely to increase. The Rangarajan Committee found 30% or 363 million people below the poverty line. If you remember, the Tendulkar Committee had found only 270 million people below the poverty line. No government likes rising or stagnating numbers of poor people. Apart from other things, this makes strong case for increasing financial allocation for social welfare programs. It also makes the existing welfare programs appear inefficient or wasteful. We learn a few important things from this discussion. Poverty estimates provide us with the reference point to engage in democratic debates about the state of well-being in the country and the need to make allocations for social policy. But poverty numbers are always political and controversial. They tend to underestimate real deprivation. Convenient or politically expedient methodologies may be adopted. We shall come back to these numbers and some of these debates when we discuss the most recent welfare program in the horizon, the Universal Basic Income Grant. I have two questions for you in conclusion. Where would you direct welfare after reading the Tendulkar Committee's recommendation? The second question, why was Rangarajan Committee's recommendation about the poverty line not accepted? Thank you.